Did you ever wonder if there was only one procedure that could help you look more refreshed and feel more confident about your youthful appearance? In this video, I'm going to share the top 7 things you need to know about blepharoplasty. That's eyelid surgery. Number 1, it's simply the best procedure. When we communicate with each other, we look at each other's eyes. They show us emotion. Are you tired, angry, sad? This is how we connect. While we may not be overly concerned about how someone else views us, we are our own worst critics, and we typically want to present as not tired, and certainly with confidence, which helps us feel better about ourselves. Today, with Zoom meetings and selfies, we look at ourselves probably more than ever in human history. When we see hooded, aging, or tired eyelids, upper blepharoplasty is the procedure to consider. Number 2, local anesthesia. Blepharoplasty is performed using local anesthesia. Perhaps we will provide a little cocktail, basically a little Valium for you by mouth to help you relax. But local anesthesia consists of a tiny little injection, the same thing we would use to remove a small skin tag. And it's the lidocaine that's numbing the eyelid. The lidocaine also contains epinephrine, which some of you may know as adrenaline. This helps to constrict the blood vessels so that during the procedure it's virtually bloodless. We have been using local anesthesia since the year 2000 in tens of thousands of surgeries, and it works beautifully. Best of all, there's no risk from anesthesia, no side effects, minimized bruising, and faster recovery. Number 3, blepharoplasty takes about 25 minutes to perform. That's bilateral, both sides. Once the area is localized, it's a matter of carefully following the previously marked areas to excise or remove the redundant skin. We also have 2 little tiny fat pockets near the corner of our eye by our nose here. You can look at yourself, or perhaps next time you're out, look at others, and you may see a more full or lighter appearance in this region by the nose. These are the fatty pockets creating a convex area. The light reflects off of this area to make it look lighter. Often with upper blepharoplasty, we will sculpt this area by cauterizing or removing some of this extra fat as well. After that, we simply close the incision with a single suture. The stitch starts here by the nose, runs back and forth underneath the eyelid, and there's a little tiny piece, little loop that hangs out both sides, and it typically is removed about 6 or 7 days following the surgery. Number 4, no pain. Blepharoplasty virtually has no pain associated with it. Yes, there's a little tiny injection to localize the tissue as we've discussed, but otherwise the only sensation you may experience, we don't always see this, is a little bit of a burning sensation as the local wears off. It's such a small region, we don't use a lot of local anesthesia, it's not necessary. So if there is a little bit of burning, we typically will use 10 to 15 minutes of some ice compresses following the procedure. That also helps with some swelling. Pain medication per se, the oxy, hydrocodones, absolutely are not necessary. In fact, we recommend Tylenol, but most patients don't even take Tylenol. Number 5, here's a fun one. I always say that every day, every week, every month, things just continue to get better and better. It's not uncommon that immediately after the eyelid surgery, patient looks in the mirror, big smile. There's immediate results. It's very gratifying. For patients where there's significant hooding, necessitating the upper blepharoplasty to start with, sometimes, very rarely, this moment feels a little bit awkward. That is, they've had so much extra hooding, so much extra skin coming in. In fact, they can't wear mascara, they can't wear eyeshadow because they simply can't see it. That following the removal of this redundant tissue, there's this moment where they're not sure what they're seeing. That is, they have an eyelid, fantastic, but the eyelid is swollen. Obviously, 5 minutes following surgery, you're going to have some swollen eyelids. So this is something that a few patients experience. For the most part, patients are extremely excited right away, and by the end of the week, the sutures are out. You can begin wearing makeup. By the first day, you can resume most normal activities. You can drive your kids around, you can work out, you can go for a walk, you can drive, all of these things. Generally, though, if you look at photos 1 week, 2 weeks, a month, 3 months, 6 months, it just continues to get better and better. So this is very exciting because immediately patients are happy and it just improves every day, every week, every month. This is truly a phenomenal procedure. Expectations should be very high. Number 6, upper eyelid blepharoplasty surgery lasts 15 to 20 years. Yes, it's true. Sometimes I'll see a 60-year-old and I'll say this in the wrong way. I'll say, you'll never require another eyelid surgery in your lifetime. Well, I don't mean they're not going to be here when they're 80. I just mean when they're 80, their eyelids are still going to look better from prior to having the blepharoplasty performed. Slowly, we continue to re-age. There's loss of elasticity and loss of volume that started initially. The biggest factor is when we do facial analysis, we really want to look at the eyebrow as well. Anatomically, sometimes this brow begins to descend over those 20 years, and perhaps a brow lifting procedure might be required. But rather than getting into a long discussion about brow lifts, suffice it to say that most patients, at least 85% of patients coming in seeking rejuvenation of their eyelids, will benefit from an upper blepharoplasty even without a brow lifting procedure. And philosophically, if we can achieve nice results with a singular procedure rather than a brow lifting procedure, that's typically what we'll offer. And number 7. Okay, this is a big topic, aesthetic versus functional eyelid surgery. What does this even mean? Here's a common scenario. Patient has hooding, they're seen by their family doctor, the doctor refers them to an eye center for the purpose of undergoing upper eyelid surgery because they're having trouble with their peripheral vision due to the extra skin. The oculoplastic surgeon performs a functional blepharoplasty, and the patient can both see better, that was the goal of the procedure, because more light's getting now back into their eye, and of course they look better too. Assuming that the amount of hooding they had meets the requirements for insurance coverage, then they're all set. Great? Probably. But what we see commonly is that these same patients come to see us and ask, why didn't they take more of the skin? And they're pinching all of this extra skin between their finger and their thumb. And here's my explanation. We consider ourselves to perform appropriate conservative surgery to achieve a natural yet younger appearing outcome. That is, we are focused on achieving the best aesthetic results possible. How I describe many of the surgeons performing functional eyelid surgery is that from a cosmetic standpoint, they are ultra conservatives. They are talented, they're fantastic surgeons, but their goal is different. Insurance is paying for the procedure to remove the redundant skin causing visual field problems, not to perform cosmetic blepharoplasty. For years, we referred patients to these surgeons with the instruction to ask the doc, hey, will you remove more tissue? But to no avail. That simply is not what they do. So we see many of these patients back in our practice. They look better after the functional eyelid surgery, but now that they have a taste of looking better, all they can see is that extra skin that wasn't removed. Again, the surgeons are doing their jobs properly. We are focused on achieving the best aesthetic result possible. I hope that makes sense, as it's a question that so many patients struggle with. Why didn't they remove more? Well, this is why. So these are 7 things to know about blepharoplasty. Perhaps the next time you see me, I will have undergone this procedure myself. Thank you for watching. Should you have any comments or questions, please leave them below, and I will reply. Thank you.